Hello pharmacists! In this video, we'll be discussing head lice. We will guide you on how to ask the right questions and identify red flags. When you encounter these red flags, you should know that the patient needs to be referred to a doctor. One important question in OTC scenarios is, have you tried anything to treat the condition? This helps us understand what has been done so far and guide us in choosing the most suitable product without causing harm to the patient. You will have different products on the table, and we'll discuss how to choose the right one. Let's dive in.
Hi, I've noticed that my daughter has been itching her head a lot lately. It's really concerning.
Hi there, I'm Luna, the pharmacist. I can definitely help you with that. Please have a seat in our counseling area.
Thank you so much.
May I have your name, please?
Sure, my name is Jennifer.
Nice to meet you, Jennifer. And what's your daughter's name and age?
Her name is Sophia Robert, and she's 9 years old.
Thank you. Can you tell me more about Sophia's symptoms?
Well, she's had an itchy scalp for the past week, and it seems to be getting worse. She's scratching her head a lot, and it's really affecting her sleep. I've even seen bugs crawling in her hair. Are those fleas?
I understand how concerning that must be. Have you tried giving her anything for these symptoms?
No, I haven't given her anything so far.
To give you the best recommendations, I'd like to ask you a few questions about Sophia's medical condition and lifestyle. Is that okay?
Yeah, of course, go ahead.
I totally understand it can be tricky knowing how to handle these things. Is anyone else in the family experiencing similar symptoms?
No, but Sophia had a friend over for a sleepover a week ago, and she mentioned having the same issue.
Got it. That could be a clue. Does Sophia share any personal items, like clothing, bedding, or toys?
No, she doesn't share those at all. She's pretty careful about her things.
That's good. Have you noticed any greasy or yellow scaly patches on her scalp?
No, nothing like that.
Any silvery, flaky, rough patches that bleed easily on the scalp, elbows, or knees?
Nope, nothing.
Any redness or pus at all?
No, none of that.
How about dry white dandruff?
Nope, no dandruff.
Okay, is this the first time she's experienced these symptoms?
Yes, it is.
Does she have any other medical conditions?
No, she is healthy.
That's good to know. Is she currently on any prescription medications?
No, none at all.
How about non-prescription medications?
No, nothing.
Does she have any allergies?
No allergies.
Thank you for your patience, Jennifer. Based on Sophia's symptoms, it seems like she has head lice. Head lice are tiny bugs that live on the scalp and hair. They're quite common, especially in kids, and they don't indicate poor hygiene. Lice feed on small amounts of blood, which can cause the itching. They spread easily through close contact, sharing hats, combs, or pillows.
Oh, poor girl.
I know it can be frustrating, but the good news is that while head lice can be annoying, they don't carry diseases and can be treated effectively.
That's reassuring.
I recommend using a pedicicide like Nix Cream Rinse. It's one of the best options for treating head lice and contains 1% permethrin. You'll want to wash her hair with a conditioner-free shampoo, rinse it well, and towel dry. Then, apply the permethrin thoroughly from the scalp to the ends of her hair, leaving it on for 10 minutes before rinsing. It's important to repeat the treatment after 1 week to get rid of any newly hatched nits. Does Sophia have long or short hair?
She has long hair.
In that case, 1 bottle should be sufficient.
That sounds good.
Just keep an eye out. If you spot any live adult lice 24 hours after a proper application, it might indicate resistance to the treatment. In that case, we might want to try a different product. But if you spot small bugs or nits, make sure to remove them using lice comb. It is important to comb through her wet hair thoroughly for about 30 minutes. It is helpful. It's best to repeat this process 3 times a week for the best results. Then continue with the second application after that.
Got it. I'll make sure to keep a close watch.
Just keep in mind she might experience mild and transient side effects, like itching or redness.
That sounds fine.
Great! And if the itching continues to bother her, you can also give her an antihistamine.
That sounds manageable.
Additionally, here are some non-drug measures. Avoid contact with infected persons to prevent spreading the infestation. Make sure she doesn't share personal items like clothing, combs, or bedding with anyone who has lice. You should wash clothes, linens, and hats in hot water. Dry them on high heat for about 15 minutes, or store them in plastic bags for 2 weeks. Vacuum furniture and soak combs and brushes in hot water for 5 to 10 minutes, or wash them with a pedicicide shampoo.
That's really helpful.
Also, if any family members or close friends shared personal items with Sophia, they should be checked and treated if live lice are found.
Got it.
After all these measures, if the itching persists after the second treatment more than 2 weeks after that, please take her to the doctor for further investigation.
That's really helpful. Now, can Sophia still go to school?
That's a great question. She can go back to school the day after her first treatment, so she won't miss too much.
Sounds perfect. Thank you for all this information.
Of course! Can we give you a call in 2 to 3 days to check in on how Sophia is doing with her treatment?
Yes, that would be great. Thank you again, Luna.